Dr. James, Diamond Physicians.
Dr. James Pinckney hopes to completely change the way Americans use insurance and access their primary care doctors. Pinckney was a surgical resident at Cedars-Sinai Hospital in Los Angeles when he was introduced to a new form of medicine.
So one night, I was taking care of a celebrity patient at Cedars, and at Cedars is a very different hospital. You kind of just do what your patients ask you to do. And they asked me to call their doctor, and it was like 11:30 at night. I said, sir, it's almost midnight. He said, I don't care, I want my doctor to know what's going on with me. I said, okay. Picked up the phone, called the doc, gave them the post-surgical issues, gave my report, and that was my first taste of concierge medicine.
It was that experience that transformed him from celebrity surgeon to medical entrepreneur.
This is an amazing concept. But when I went to bed that night, I was kind of thinking, like, how can I make this accessible to everyone and not just the super wealthy?
Pinckney, Dr. James to his patients, who he refers to as clients, is the founder and CEO of Diamond Physicians.
So we're trying to take medicine back to the 50s and 60s. So just like back in the day when you had your family doctor that would come and see you, do a house call, you could talk to them at any time, we're bringing that scenario back in 2015. So our clients, they have my phone number. They have my email address. They can call me anytime. It's truly 24 hours a day.
Diamond charges a monthly fee for unlimited visits. The costs start at $45 for kids. Adults pay between $95 and $295 per month, depending on their age.
We've got all types of clients. We've got clients that are uninsured. We've got clients that probably make $25,000 a year. We've got teachers. We've got engineers. We've got lawyers. We've got a Hall of Fame NBA coach. We have the entire gambit, and that's the beauty of Diamond. Everyone is treated the same.
Dr. Anthony Lissy is the vice president at Diamond. He says a core principle in their practice is preventative medicine, which means offering advice on everything from diet to exercise programs, with the goal of keeping you healthy.
The studies that have been done on our type of medical practice model versus a traditional model have proven that there's about 70% less incidence of chronic disease, there's 80% less hospitalizations.
When people started hearing about Diamond Physicians, what was their reaction to this?
Well, the first reaction was, it's too good to be true. Is this for real? Can I really pay for my child $45 a month and have a concierge doctor on call 24 hours a day? I can call your cell phone, I can email you. It's such a foreign concept to most people. Most people don't understand concierge medicine. They see shows like Royal Pains and they assume that it's all house calls and it's only for the rich and famous. So we're fighting that stigma and those preconceived notions that concierge is only for the wealthy. And we want to obliterate those notions and let the world know that, hey, this model is for everyone.
Yesterday, I got a text message at 2 p.m. from a frantic mom saying, hey, here's a picture of my son. He busted his head open skateboarding outside. Within 15 minutes, I met them up here and was able to take care of that. I couldn't do that in a traditional model. A typical physician on a Sunday afternoon would have said, hey, go to the ER, go to urgent care. Me, I can take care of them literally 24/7.
If you're on call 24/7, how's your lifestyle?
Yeah, we get that question a lot. Well, how do you do it? How can you be on 24/7? So I tell people, well, look at it this way. If I was practicing in the traditional manner, I would have to get here about 6:30 in the morning, clean up some charts from the day prior, work till 6:30, maybe not get a lunch, still have to chart on all those patients that evening when I get home.
Diamond is part of a growing trend. When a Maraflex CEO, William Short, decided to abandon traditional health insurance and convert to a self-insurance program for his company, he included Diamond Physicians in his plan.
I have 150 employees that I'm responsible for every 2 weeks for their payroll, and I offer health benefits to attract and retain the best talent. But it also becomes a business decision and a personal finance decision. And so in doing that, we looked at it and said, okay, we're going to go self-insured. We're going to put in our plan, but we are managing the claims below our stop-loss insurance plan. And who is the best person to be able to manage this risk? An expert. A physician is the best to manage individual healthcare risk, where the expense comes from.
Short says patients must become consumers and learn to shop for their healthcare needs.
The efficiency on it and the price point is huge savings. That is a big part of the cost of healthcare. is this artificial game that's being played in terms of getting to the true cost of care. What's the true cost of care, what's being reimbursed, and what people are willing to do it for.
You know, the Affordable Care Act, unfortunately, forces the American people to buy a product that is subpar. You know, the insurance exchanges, it's not a great insurance policy, and it's expensive. Prices have risen almost 300% in some cases. So we want to lower those prices back down to where they were in 2008, 2009, 2010, and then have these insurance companies focus on the catastrophic piece, focusing on forming an insurance policy that clients can buy that offers them protection against disaster, just like your car insurance, just like your home insurance. So we're not trying to get rid of insurance companies. Insurance is important, but it should not be used for the day-to-day routine maintenance of health.
The doctors at Diamond hope to take their model across the country. And why not? According to an August 2014 report from the Heritage Foundation, the number of physicians in concierge practices jumped 582% from 2010 to 2012. But even with the rapid growth, it's not yet a universally accepted alternative.
Some insurance companies don't like the idea of their enrollees seeing concierge physicians because they're afraid that if you're paying for a service, you expect to use that service more frequently. But as experience shows, that people aren't trying to use more services, just more efficient services.
There's a very small segment of the population that understands that you can shop healthcare pricing. Most people are caught up in the insurance model, but a lot of institutions will not negotiate with me because hospitals don't want to lower their bottom line. So we have to figure out, okay, what does the client need and where can we get it done for the best price and with the best doctors?
Is this a case of David versus Goliath?
It probably will be someday, you know, but right now we're not even the size of David. We're like the pebble. So we're just a small, family-owned business that's trying to grow rapidly, and someday we will be there, and we will catch the attention of the government. And hopefully they see our model as a way to cut healthcare costs. I mean, we're spending 17% of our GDP on healthcare, more than any other industrialized nation. If we don't curb spending now, this country will go bankrupt.
Many experts believe the biggest problem in healthcare today is the failure for consumers to understand the economic relationship between managing cost and providing care. They say unless primary care becomes more consumer-driven, with less third-party management, the system will simply implode.
And so if a percentage of the population continues to believe the lie that the government will take care of them, and that don't worry about it, health care is a right, that everyone that goes into health care is here to serve you, and they have no basis for their own existence or for their own purpose, then we're going to have a system that is back to, yeah, you can have health insurance, you can go to a government hospital, but you'll wait in line. It's better actually from a budgetary standpoint if you die in line. And what will lead to is the following. Either the government will come in and say, dear 65 million people that planned ahead, you are no longer going to be able to do that, and will outlaw the current process in terms of choosing what you want, choosing your doctor, choosing your plan, choosing your hospital. Or it's just going to be a complete collapse that's going to be an entitlement collapse, and it's just going to implode because once you have too many people that aren't actually contributing to the system and you have less people actually producing, it's a numbers game. You cannot distribute more with less.